My name is Richard Graves and I'm an orthopedic surgeon at CHRISTUS Trinity Clinic. I grew up in Waco, was born and raised there until I was about 11. Then I moved down to the coast to a town called Lake Jackson, which is a little bit south of Galveston. Professionally, an orthopedic surgeon named Rich Berger. He's in Chicago at Rush University, and he's a joint replacement surgeon, specializes in hip and knee replacements for the most part. And he's the one that got me interested in doing that, which is the bulk of what my practice is now. And he showed me what a practice can be like that's functioning as a well-oiled machine as far as the team goes, and throughput and volume and satisfaction of the patients. And he taught me how to make each patient feel special. I played football in college and I really didn't know what I wanted to do, and so I ended up getting a degree in chemical engineering because I was always good at math, and where I grew up that's what everybody did. But instead of going to work for Dow Chemical, which most of the people did in that region, I actually took a job with a pacemaker company. And I was developing plastic materials for implantation, and then I started to travel and got introduced to other things. And one of the key things in most of the conferences I went to were orthopedic joint replacements. And I got interested in doing that. And I just felt like that's what I was meant to do for the first time in my life, although I was well into a career. And I decided I wanted to go back to medical school and do joint replacement. To me, orthopedics is the best job in the world, there's no doubt, because we take people that are injured and we can really help them and heal them. Some aspects of medicine, I think it's more maintaining and tolerating what you have, but in our case, many times we can create huge improvements in quality of life, and you see the satisfaction on the patient's faces. My philosophy is to treat every patient equally. I think that in this community, I see patients with all types of socioeconomic backgrounds, and for me personally, that doesn't influence how I treat them. Everybody deserves respect, and they come to me with a problem, and many times they're vulnerable and they seek out help, and I feel like I'm not just obligated, but I have this deep desire to help them, and so my goal is to help them achieve the best quality of life that they can.